I'm Maura Carley, founder and president of Healthcare Navigation. We're insurance consultants who serve individuals and businesses. Our typical work includes providing support for medical claims, medical bills, transitioning from one source of coverage to another, and helping educate people about our complex health insurance world. I started the business in 1999 when I was a much younger gal, but I'm sorry to say that many aspects of our health insurance world continue to disappoint. That is the main reason we are launching this series, to share our knowledge and skills with as many people as we can to help them protect themselves from overpaying for medical charges they don't owe. It's a difficult, awkward time to criticize the healthcare field. Clinicians are working day and night and putting themselves at risk to protect us in this COVID-19 era, and we're very grateful for that. But our issue is with the administrative side of things, primarily medical claims and medical bills. To make this concrete for you, I want to give you a couple of examples. And they're examples from my own medical history, just because it's easier to use my own and not have to get permission from others. And honestly, I've been blessed with very good health as an adult, but I had a period of testing last year, and that was accompanied by several misadventures, primarily with anything that required an additional layer of authorization or where the insurer requested additional information. So I'll just give you two examples. One, an MRI was ordered for me. Now, the company that the insurer uses for prior authorization of radiology procedures has never authorized the MRI. So to my great dismay, even though this was done in early September, the hospital still hasn't been paid. And that's unfortunate. A mistake on the hospital's part is that they let me have the MRI, which shouldn't happen when you don't have prior auth, but was fortunate for me. Now, a mistake on the insurer's part is that the MRI was denied, but they paid for the claim for the physician who read the MRI. That's not supposed to happen either. Makes me very happy. I like to see doctors and hospitals paid for what they do, which is why I paid the coinsurance, which will be another one of our topics. But many things went awry here, and let's not let that organization that provides prior auth get off the hook either. I called them, and I have to say they're pretty easy to get through to, unlike so many entities in our healthcare universe. But there was another radiology procedure, and the information used to authorize that procedure could also be used to authorize the MRI. So I asked them, would they do that? They agreed that that information was sufficient to authorize the MRI, but they said they couldn't do that, or maybe they wouldn't do that, because the two procedures were submitted under separate case numbers. Now, that is so ridiculous. And again, I don't want to sound arrogant, but I've worked in the healthcare field my entire adult life, and I've worked on the insurance side, so I know that they have an obligation to be responsible with the premium dollar. They can't pay claims willy-nilly, but again, that is ridiculous. They have in their possession the information that is required to authorize the MRI. So let's go to the laboratory work that was done. This time, the hospital got paid, but the physicians didn't get paid, the pathologists. That shouldn't happen either. And I could see from going on my website that the claim kept getting resubmitted, and the explanation of benefits stated at the bottom that the insurer was requesting additional information. Now, I can't know exactly what happened. All I can tell you is that in December, for blood work done August 13th, I received a bill for $4,907. That's a lot of money. And fortunately for me, I know I don't owe that money. I'm in network. This was medically necessary. My insurance company website, another thing we'll talk about, for this claim says 0 member responsibility. But somebody else might have paid that claim prior to my insurer paying it, or their insurer paying it. In early January, the insurer did pay this. But what if I had paid it? How easily would it have been to get my money back? We don't know. So to wrap this up, I got a new statement from the pathology group. This time, there's no reference, of course, to the $4,907, although I like to see the history. I like statements that show you last month's charges, and then what was paid against that, what was written off against that, and so on. But that doesn't have that. I just have a new bill for $422. Admittedly, a much smaller amount. Why it got separated from all the rest, I don't know. But reading the detail, date of service, 7/13/2020. I wasn't even a patient then. Blood hadn't been drawn then. And maybe that's just a typo, but one would hope, with all the sophisticated software out there, that I wouldn't be sent a bill for a date of service that preceded my being a patient. So as you can see, an awful lot can go wrong. Our objective is to help people move up that learning curve so you're protecting you and your family. We're going to have a number of different series. We're focused on claims and bills now. Later, we'll be working on skills rather than just education. Beyond that, evaluating coverage options. Beyond that, why do we accept this very flawed system? Let's improve it. But I'm getting ahead of myself. We have put all of the basic series up so they can be viewed now. All together, they're under 45 minutes. You can view them all together. You can view them one at a time. But every week, we will publish written information that accompanies each of those topics. We welcome your comments, your feedback. We'll do our best to incorporate those in future videos. Please stay with us. Thank you for watching, and take good care.